tumors is often thought to be a rare group of tumor that's kind of boutique, and also there's really a truly unmet medical need in this area. Up till now, more recent period of time, only somatostatin analog has been approved for control of hormonal syndrome from these tumors. And in the pancreatic neuroendocrine area, only one drug has been approved for the treatment of systemic disease. However, there's a recognition that this group of tumor has been increasing in its diagnosed incidence over time. 30 years ago, the diagnosed incidence was around 1 per 100,000 in the large population-based registries. However, with improvement in our diagnostic methodology and better understanding, we now understand the diagnosed incidence is approximately 5.25 per 100,000 in the large population-based registries. Nonetheless, this still represents a rare tumor, accounting for only about 1% of all cancer diagnosed each year. mTOR, or mammalian-targeted rapamycin, is a central regulator of growth proliferation. It's evolutionarily conserved from the days of single-cellular organisms. We got interested in the mTOR pathway because we realized a number of rare genetic cancer syndromes in the mTOR pathway are associated with the development of neuroendocrine tumors, including tuberous sclerosis, von Hippel-Lindau syndrome, neurofibromatosis. Also, we noticed that dysregulation of the mTOR pathway among patients with sporadic neuroendocrine tumors is associated with poor prognosis. I'm going to briefly talk about the RADIANT-3 study. This study was recently presented in the World GI Congress, another event sponsored by ESMO. More data will be presented later on Monday about this study. So this is now a study, a rigorous, I would say, properly powered phase 3 study in a really rare disease. For the pancreatic neuroendocrine tumor subgroup, the diagnosed incidence is approximately 3 per million per year. It accounts for about 1% of all pancreatic cancers by diagnosed incidence and 10% by prevalence. The study enrolled 410 patients. They were stratified by performance status and prior chemotherapy and randomly assigned to everolimus plus best supportive care or placebo plus best supportive care. This was truly a global effort with 410 patients being enrolled from 18 countries and 83 sites. As you can see here, our European colleagues here heavily participating in the study and is a key to the contribution to the success of the enrollment and the results that we will see. Here's the result as was presented at World GI Congress earlier this year. The PFS by investigator review showed a superior prolongation of progression-free survival from 4.6 months in the placebo arm to 11 months in the everolimus arm. This corresponded with a 65% reduction in the risk of progression with hazard ratio of 0.35 and a highly significant p-value. The adverse events seen in this study were similar to other studies with everolimus. The most common adverse events was stomatitis and rash. However, the incidence of grade 3 and 4 adverse events were fairly low. Another study is the RADIANT-2 study, which will be presented later at this meeting on Monday. This is a parallel study, double-blind placebo-controlled study again, for patients with advanced neuroendocrine tumors with a history of carcinoid syndrome. Total of 429 patients were randomized to either everolimus plus octreotide or placebo plus octreotide. The primary endpoint was progression-free survival. I will not show the data as it is still under embargo, but I would welcome anyone who is interested to come to the Monday session where the data will be presented. Again, this also shows the importance of a global effort on rare diseases. 429 patients were enrolled from 16 countries and 93 sites with participation, a lot of participation from our European sites. So in conclusion, prospective randomized phase 3 study in rare tumors are feasible in multinational setting. The RADIANT-3 study demonstrated significant benefit for everolimus in pancreatic neuroendocrine tumors and potentially sets a new standard of care option for this group of patients in this disease. The RADIANT-2 study demonstrated, I would say, a meaningful clinical prolongation in progression-free survival. The more data will be presented on Monday during the late-breaking session. Seeing together, these results supports the efficacy of everolimus in advanced neuroendocrine tumors and show that we can make progress in rare diseases.